All right, here we are, and I just want to make sure we are recording. Good morning, everyone. And we are. So good morning. All lines have been muted to ensure the quality of the audio and provide a distraction-free learning environment. At the end of each presentation, we will allow for a short Q&A. You can use the comment section to the right to submit any questions, and I'll be able to facilitate any questions to each presenter that you submit. At the end of the program, we will send you an evaluation through your email. It'll get sent out in about an hour. We ask that you please provide feedback to best serve you and provide our sponsors with the information needed to continue our supportive efforts. With the completion of the evaluation, we will select at random 3 prize winners for a $25 gift card, and we'll announce those winners Monday. Also, everyone that registers and attends this summit will receive a small gift from the chapter. It's a little window cling lupus awareness sticker, so that'll be great to help us just create some awareness. And also, I do have a disclaimer. The Lupus Foundation of America, Greater Ohio chapter, does not give medical advice to patients regarding their treatment of lupus. Your physician is the best source of information regarding medical management of your lupus. This program is designed to help educate you and help you make informed decisions. Please discuss any treatment options with your healthcare provider. Okay, we can now begin our program. And so I just have a little intro here. Again, welcome and thank you for joining the 2020 Virtual Fall Lupus Summit. My name is Leslie Tierney. I'm the Vice President of Operations for the Lupus Foundation of America, Greater Ohio chapter. I'm a registered nurse and I've been working with the foundation for over 20 years. In my work with the LFA, I have seen firsthand the triumphs and the struggles of lupus patients. This is especially true now during the COVID-19 pandemic, where lupus patients are facing new challenges. How do lupus patients adjust to the new normal? The whole world is still trying to adapt, but for lupus patients, this is especially challenging. Your health and safety should always be top priority. Although we cannot physically join together, we're still able to provide the latest, most accurate information on lupus. From the start of COVID-19, our chapter has ensured that lupus patients across Ohio have up-to-date, relevant information on COVID-19. While we still do not have all the answers, our chapter website is designed to provide you with as much information on COVID-19 as possible. You can access this information at lupusgreaterohio.org. There's information on financial tools, information on hydroxychloroquine, the latest update on COVID-19, information on Benlysta and Medicare. Please take time to visit this valuable resource. We can continue to guard ourselves with an arsenal of information to move forward in our rapidly changing world. Please continue to follow the CDC guidelines and make sure to protect yourself. Stay at home as much as possible. Wash your hands, keep your hands away from your face, and just practice good hygiene. This Fall Lupus Summit is very different than in years past, but we're grateful to be able to still host and gather with everyone. Please know that this chapter truly cares about you and your journey with lupus. To all our members that we look forward to seeing every year while we gather at the Lupus Summit, know we truly miss you. We will focus on staying well, and that includes making sure that you take care of yourself and that you are a proactive, educated lupus patient. Remember, knowledge is power. Our panel today are dedicated physicians from the Metro Health Hospital. Today we have Dr. Ballou, Dr. Antonelli, and Dr. Lu. Joining shortly in a little bit, Cindy Fisk from GSK and Us and Lupus. We actually double booked her today, so she'll be joining us a little later in on the program, and she'll be popping in about an hour. So, okay, just give me 1 second here to get our presentations going. And I apologize, give me 1 second, and I'll hand it over to Dr. Ballou. Oops. And almost there, Dr. B. It's just taking a bit of a lag time. Very good. Here we go. Dr. Stanley Ballou is a graduate of the University of Pittsburgh School of Medicine, did an internal medicine residency, chief medicine residency, and rheumatology fellowship training at Cleveland Metropolitan General Hospital, now Metro Health Hospital. He was the director of the Division of Rheumatology at Metro Health Medical Center from 1998 to 2009, and the Rheumatology Fellowship Training Program Director from 2004 to 2016. He is currently the director of Metro Health Medical Center Lupus Clinic. So help me welcome Dr. Ballou. Thanks, Dr. Ballou. Yay.
Thank you, Leslie. Thank you for that wonderful introduction. Before I begin, I'd like to thank all of our guests who are joining us this morning. I wish it could be in person, but hopefully we'll all be able to get together next year. And I'd like to thank the Lupus Foundation for putting together a great educational program and choosing that wonderful picture of me that you just saw, which is what I actually look like. So we'll get started on a couple of topics that I think are of importance to all patients with lupus. First is, what's the big idea with all those laboratory tests? Here's what you're all concerned about. You see a young lady who's expressing her interest in this, having a laboratory test done, and the person who's drawing the blood seems to be having a good time, actually. So why is it that we need to do these laboratory tests? Next slide, please. I feel sorry for that poor lady, as I do for all of you who need laboratory tests. So why do we do laboratory tests? Because to see what's going on with the patient. You all know that lupus is a complicated illness. Many patients come in with rashes, joint pains, and we can detect these easily. We can see the skin rash. We can see if the joints are swollen. We can feel if the joints are tender. But what about patients who have anemia? And that occurs in over 50% of patients with lupus. There is no way to tell if a person's anemic by their symptoms. It has to be done by a blood test. And even more important, what about if a person has kidney disease, which is the most severe problem that lupus patients have? There's no way to tell this. The kidneys are buried deep down in the abdomen and don't cause any symptoms. The only way we're ever going to know if a person has kidney disease is by doing a urine test and a blood test as well. So we need to know what's going on. Next slide. Another reason we do the blood test is to check for inflammation. And we have several tests that your doctor can order, and you see them here on this slide: ESR, CRP, C3, C4. These are tests that tell us if the person has a lot of inflammation or not too much inflammation, and then this will guide our therapy. So we can cut back on the prednisone if there's not much inflammation, or we can change medicines. And the last reason we do a blood test is for safety. Some of the medicines can affect the blood count, or the liver, or the kidney. Medicines like methotrexate or Imuran. And so we need to check these tests periodically to make sure they're still safe. Can I have the next slide? So how often do we do laboratory tests? If a person's illness is active, that means they're having symptoms, they're having rash, joint pains, some pains in their chest, or other problems. We may need to check the laboratory test, the blood test, or the urine test as often as every 2 or 3 months. Next. If the person is doing fairly well, which we're always aiming for, and that's the goal of our treatment, and their symptoms are improving, it'll be every 4 to 6 months. And finally, if a person actually achieves remission, and I put down yay here because it's not all that common, unfortunately. But for the 5 or 10% of our patients who do achieve remission, we may only need to do the laboratory test once a year. That's a good thing. But we have to keep an eye on these tests for safety purposes and to see what's going on with the person. So I'm going to switch gears now a little bit. We can certainly answer questions later. To a topic that is on everybody's mind is how can I control my pain? Because pain is a big problem for many patients with lupus. So we're going to talk about this a little bit. And what are the choices? Well, it depends on where the pain is. If it's a headache, of course, it could be something as mild as a tension headache or a migraine headache, and that's going to be treated differently. If it's a chest pain, it could be pleuritis, which we have medications for, or it could be something more serious, in which case we need to know about that and the patient may need emergent attention. What I'm going to spend most of my time talking about is joint and muscle pain, which affects about 80% of lupus patients. Next slide, Leslie. So what are our choices for musculoskeletal pain, which means joint pain or muscle pain? Again, 80% of patients have this. What about NSAIDs? You know what NSAIDs are. Those are medicines like ibuprofen, Advil, Aleve, naproxen, and many others. They do help inflammation. We use them in patients with arthritis, but we have to use them very carefully, particularly in patients with kidney problems, for whom they may not be used at all. A safer choice for many patients is acetaminophen or Tylenol. That's a widely used medication. It's mildly effective. It's not extremely potent, but it is a totally safe medication. And we feel very comfortable using this in varying doses for joint pain. What other options do we have? Next slide. Opiates. These are probably not a good choice for most patients. In this day and age, we're very concerned about narcotic use. It results in a great health problem for our entire country. And we all know that opiates are only temporarily effective. And as people use them, the pain relief wears off, requiring higher and higher doses. So for most patients, opiates are not a good choice. Next slide. But we have some other options. Muscle relaxers sometimes can be helpful. For patients whose pain is in muscle cramps, these can be helpful, and if the person doesn't have drowsiness. And the same thing with other medicines for nerve pain. We have a few medicines such as gabapentin that can help nerve pain. These last two categories are helpful for patients with this kind of symptom, but we're careful to avoid excessive drowsiness. Do we have other choices? Well, what about this? Some of you are familiar with this. In fact, about 20 million Americans have personal familiarity with this. This, of course, is the marijuana plant. And we're going to talk a little bit about this and see if it has a benefit for patients with lupus. So marijuana, of course, which everybody's heard of and familiar with, comes from the cannabis plant, of which there are several different species. Cannabis sativa, Cannabis indicus, another one or two. These plants, like many other plants that are used for medicinal purposes or for recreation, like chocolate or cocoa or coffee plant, has many chemicals, and they're called cannabinoids. There's over 80 of them. There's two major ones that we're all familiar with. Well, one that everybody knows about is tetrahydrocannabinol, THC. That's the one that causes euphoria and that people usually inhale in a cigarette. It binds to various receptors in the brain, which can contribute to the sensation of euphoria and what people call the high. The other major chemical from the cannabis plant is cannabidiol, which is CBD. And people have heard about this. It does not affect the brain, but it can affect other receptors throughout the body and may have benefits for a number of reasons. And we'll talk about that briefly. CBD is available as an oral preparation, as a tincture that's put under the tongue, topically to be rubbed on, or it can be inhaled, usually using a vaporizer. So a little bit more about cannabis or marijuana. Next slide. What are the potential benefits of this agent? There's a lot we don't know, but here's some things we do know. Occasionally, the CBD or THC have been used to treat convulsions in certain individuals with seizures, and they may be effective for that. That's going to be a limited use, but it can possibly is helpful. THC, which is marijuana, can increase appetite. That's important for some individuals. For example, people who have severe cancer and are losing their appetite. Many of us, unfortunately, don't need to use THC to increase our appetite. There is widespread thinking that CBD or THC can improve immune function by restricting it if it's overactive or reducing inflammation. And this is the area where we'd like to have more data. Research is going on. We do know that THC at least, and perhaps CBD, can reduce stress and anxiety in some individuals, and in some individuals can help with sleep. The final question is, does it really help pain? And we'll talk about that briefly. Next slide. So what are the risks of THC or CBD? Well, most of the risks are with THC, unfortunately, and with chronic use. So people who smoke marijuana daily, and we all know that that happens. The major concern there is that people, it's like almost like smoking cigarettes. People are at increased risk for getting mouth and throat and lung cancer, or getting chronic obstructive pulmonary disease, chronic lung disease, if they're regular users of pot or marijuana. Those are the concerns we have. Recently, you probably have all heard within the past year, since vaping has become a very popular phenomenon, particularly among young people who like to vape CBD, there has been an uncommon but very serious problem requiring hospitalization for pneumonia in patients who do vaping. This has been reported now, and all physicians are widely aware of this in young people. They do the vaping and they'll get short of breath and cough, and they'll go to the emergency room, and they have to be admitted, and they have to be sometimes in an intensive care unit. So this is a concern. It's uncommon, but we're aware of this. What about long-term use of marijuana? And we know that there are individuals who use it for years. For patients who start at a young age, there's a mild concern that they may have a few problems with their brain, such as hallucinations or reduction in their mental capacity, their memory, their thought processes. This is a little bit of a concern for the long-term users. And for that reason, we don't really support its use for people at a young age who potentially can use it for 30 years and then develop these mental problems. Next slide. So this is what vaping, of course, looks like. Just as if somebody doesn't know, now you do. Next slide. So pain treatment. And here we're talking about CBD. And CBD is not regulated. It's available. Anybody can buy it over the counter in stores. There's a lot of stores that sell it. As we talked about, it's available in a pill or a tablet that you can take orally. It's available in a liquid you put under your tongue for about 60 seconds or 120 seconds. It's available in ointments or gels to rub onto your tender areas of your body. And you can vape it. And the vaping is not recommended so much because of that acute illness we just talked about. Recently, a pain conference of international pain experts was held this summer, and they advised that it's possible that CBD can be effective in some individuals for pain. Among the clinical trials, 15 out of 18 showed some benefits for pain relief. Not in everybody, but in some individuals with arthritis and muscle pain. They recommended starting slow at a low dose of CBD and going one, say, for example, a tablet It's available in a low milligram tablet strength of 2 or 5 milligrams, starting one daily or one twice daily, and gradually increasing if necessary. The problem, of course, in using CBD, since it's uncontrolled, is it's expensive. The government and physicians, of course, have no control over this because it's made by entrepreneurs. If you're going to use CBD, you should make sure it's from a reputable source and not from your next door neighbor in the backyard who decided they wanted to make it in their basement. You need to have a reputable source. The cost is, I'm thinking, usually around $50 to $60 per month. It can go higher. If you choose to use it, it's probably best used as the tablet or the ointment or the oil or the gel rather than the vaping because of possible lung problems. So next slide. Here's the last slide for people who want more information. The Arthritis Foundation has a pamphlet on CBD guidance. It's an interesting little pamphlet. The Arthritis Foundation is happy to send it or provide it to any individual for free. You simply need to contact the Arthritis Foundation either on their website or by calling them, and they can send it. It's a very small pamphlet, but it does give you some information with current guidelines, some of the things I just mentioned to you. And I think we're going to, over the next few years, we're going to know more about what the role of CBD is for control of pain. Currently, here at Metro, we are studying a medicine very similar to CBD for pain in some patients with lupus. And we hope to have the results of this within the next year or two. Thank you very much for listening. I'd be happy to answer any questions.
Yes, we do have questions, and I apologize. We're going to open up the question box to the right where you could submit some questions. And as some of our members already submitted some questions, and I apologize for my screen, but I am going to pull that up here. I just need a second to navigate, Dr. Ballou. And I do apologize, guys. My screen is just not cooperating with me, but that's okay. We will figure this out. I should mention that the Lupus Foundation also has on our website the chapter resource guide, where you can find additional information on medical marijuana and CBD oil. Although we are good friends with the Arthritis Foundation, and I know Mary would be happy to send me over some of those pamphlets that they have too, so I'll be sure to contact her and get some pamphlets from them. But okay, Dr. Ballou, so here is a question, and it says, why does my doctor not run an ANA every time I have lab works done? Could you address that?
Yes, it's a good question. The ANA test is the test to help diagnose lupus. Once a person has a positive ANA, they tend to have a positive ANA forever. It stays in your body forever. If you go somewhere else and have an ANA test, it's going to be positive. And so there's really no need to repeat it. If you're known to have a positive ANA, you're just going to have it. So it's not a test that we repeat.
Okay. This is kind of correlating into other illnesses also, but I have chronic lymphocytic leukemia and lupus. How does having CLL impact my lupus? Could you address that?
Well, yeah, that's a complicated question, and it's going to be a difficult issue because with the CLL, leukemia, you'll of course be followed by a cancer doctor who will probably choose some medication for that. Interestingly, some of the medications that might be used for CLL could potentially be helpful for lupus. So it's possible that the lupus would actually improve somewhat as a result of chemotherapy that the cancer doctor would use. But in any case, the two doctors, the rheumatology doctor and the cancer doctor, are going to have to work together for this. This is an unusual case.
So here we go. My physician talks about my complement levels. What does this mean?
So I showed that this test called C3 and C4, which were on a slide, those are complement levels. Those are specific tests for inflammation in lupus. They're very important. It's an important blood test that we do usually about every 3 months. If they're abnormal, then it makes us concerned. We want to choose different medications or more medications. If they're normal, we feel reassured that the patient is on the right track.
Okay, and this one's coming from online, and it says, is CBD legal, and how different is it from regular marijuana?
So CBD is legal. You can buy it at a store anywhere. It's not controlled by the government. There's no prescription available. It's not covered by insurance. So you can just purchase it. Because it's not controlled, the quality of the CBD that you buy is never quite certain. But you want to make sure you get it from somebody who's reputable. Now, it's much different than marijuana, because CBD does not cause euphoria. It doesn't cause a high. It can help pain relief, but it doesn't make a person feel disconnected with or high. It doesn't do those things. Marijuana does, and for that reason, it is a controlled substance.
This is a good question. Do you ever see a specific test being used to diagnose lupus in the near future?
Yes, there are additional tests being developed. We always know about the ANA, which is the most famous and the oldest and still a very good test. Anti-DNA is a test for antibodies against DNA, which is also very important. Some newer tests are being developed, and they're becoming more widely available nationally in the United States. They're likely to be a little bit more expensive, but they can help with the diagnosis in some cases.
Okay, and I think I have one more question. There are quite a few coming in online, and we'll have a little bit more time towards the end of the presentation. This one is a little bit of a longer question, but it says, I have lupus and also neutropenia. My white blood cell count went as low as 1.9 in the summer, before the summer, and now it hovers at 2.2. I have a hematologist along with a rheumatologist, and I've been on Plaquenil for over 2 years without problems. I have extensive lab testing and a bone marrow biopsy to determine the cause of my neutropenia. None was found. I was taken off Plaquenil to see if it was causing that to drop. It found not to be the cause, and there is no appreciable difference. I am now back on Plaquenil, and I've been told that the low white blood cell count puts me at high risk for infection. Is this common for lupus patients? Is there anything that will help raise my WBC?
It does happen in lupus patients. In about 1 out of 5 lupus patients will have a low blood count of this degree. It sounds like this individual has been completely evaluated by 2 good doctors, a rheumatologist and an oncologist, and they've discovered no other reason for the low blood count. It slightly increases risk, not to a great extent, but to some extent. And for that reason, patients should be cautious. They should be cautious, like we are now with regard to the corona, washing hands, maintaining social distances, particularly from individuals who have illnesses, common sense type of things to protect yourself. Plaquenil is still a good choice, and I'm glad this person is back on the Plaquenil and may be likely to keep them going smoothly. And so I think that the outlook is pretty good, and we do see this.
Okay. You know what, Dr. Ballou, I'm so sorry. One more question for you, because I won't I really would like to ask this. I've had lupus for some time, working with pain management in the past. I was told if I use medical marijuana that they will not treat me. I haven't felt comfortable bringing it up again. From a rheumatologist standpoint, is there an issue with using medical marijuana for pain management?
That's a tough question, a difficult question, because it's going to vary according to the rheumatologist. Some rheumatologists are not going to be concerned about occasional use of medical marijuana, and we hear from our patients, I hear this, that sometimes it's effective. Some physicians are going to be a little bit uncertain about use of this, particularly if their patient is already taking immunosuppressive or chemotherapy, powerful medicines. And that puts these patients at a little more risk of having problems. So if a person is, for example, smoking marijuana, which is the typical way patients use it, and you're on some of the more powerful medicines we use for kidney disease, it does present a slightly increased risk to your health. And that makes, I think, some rheumatologists uncomfortable. I would have to tell patients this just for their own safety.
But they should feel comfortable if they wanted to talk about it and maybe ask why the
Absolutely.
physician feels that way. So, you know, it's okay to ask and have the conversation.
Yes, absolutely. I love when patients admit to me what they're taking, and I think that's fine. And I never want to be critical of what they choose to do.
Well, that's why you're a favorite doc, Dr. Ballou. You want to listen and be heard and have an open communication there. So that's great. Well, thank you. And we'll jump back to more questions towards the end. And so thank you, Dr. Ballou. I really appreciate it.
My pleasure.
Okay. And I see Cindy joined us. So thank you, Cindy, for popping in here. And okay, that brings us to our next presenter. We have Dr. Maria Antonelli. She is a board-certified staff rheumatologist in the Division of Rheumatology at Case Western University Department of Medicine at Metro Health Medical Center in Cleveland, where she has also completed her residency, fellowship, and served as chief resident. She is an assistant professor at the Medicine of Case Western Reserve University and is passionate about training fellows and residents. She has a special interest in lupus and will focus her presentation on lupus and vaccines. And we welcome Dr. Antonelli.
Thanks for having me, Leslie. So today I'm going to be talking about lupus and vaccines. Next slide. So first, I wanted to focus on why this topic is important. Why are vaccines important to patients with lupus? The immune system is the part of the body that fights off invaders like bacteria and viruses. Because lupus is a condition that causes dysregulation and abnormal functioning of the immune system, lupus patients are at higher risk of infections. This is for two reasons. First, because of the lupus itself, which causes a confused, malfunctioning immune system. The immune system, so to speak, in a lupus patient is busy causing the lupus, and so it has trouble fighting off invaders in an infection. Secondly, medications that we use to treat lupus affect the immune system, which causes a higher risk of complicated infections. An important thing to note is that infections are often a trigger that cause lupus flares. Since vaccines can prevent infections, these are very important for patients to prevent lupus flares and maintain overall quiet lupus disease activity. Next slide. Some basics about vaccines. Vaccines are substances that are given to a person to provide immunity from an infectious disease. They come in two basic varieties: the inactivated or dead form, so to speak, which contains part of an organism, such as a protein or a carbohydrate. The other type of vaccine is a live vaccine. A live vaccine is called an attenuated version of the real infection. This means the organism has been altered in a laboratory to produce a milder or no infectious symptoms when given to a person. Both types of vaccine are given to teach the immune system what the organism looks like. The immune system will produce a response in the form of antibodies. Antibodies are produced by the immune system as sort of a memory if the body is exposed to that organism after vaccination. In this way, the immune system can mount a very rapid response because of this memory. There are two caveats. No vaccine is 100% effective. For a whole population, not every person will respond the same. In addition, even every person who does respond, the immune system may be different. But even partial protection is better than no protection. For example, if a person who has no vaccination to a certain illness gets exposed, may have a very severe illness in response to that infection. So a severe infection, which may put the person in the intensive care unit, may require a breathing tube and mechanical ventilation, may require strong medications. However, if that same person receives a vaccine, the infection may only produce a milder version like the sniffles or achiness, if any symptoms at all. Another thing to note is that some vaccinations can be confirmed by blood test. For example, the measles, mumps, and rubella, as well as hepatitis B, can be confirmed in a blood test. However, there are other vaccines that have no blood test, and these would include things like the flu shot or pneumonia shot. So it's important to keep good records of your vaccination status, especially if you get care from multiple providers at different health systems. Next slide. The Center for Disease Control, the CDC, makes a recommendation for patients of all ages for vaccination based on travel plans, occupation, comorbidities, including problems with the immune system, cancers, and other chronic diseases. The CDC, however, does not provide a special schedule for patients with lupus. Most rheumatologists extrapolate and use a schedule for persons who are immunocompromised based on patients' medications and lupus disease activity. All adults are recommended to have the yearly flu shot, as well as the tetanus diphtheria update every 10 years. The CDC website has excellent tables like the one shown here that indicate what recommendations are based on for what patients. Next slide. The next several slides, I'm going to focus on several specific vaccines which I thought were important to patients with lupus. The flu vaccine is probably the one we talk about the most because we talk about it every year. The flu shot, the flu vaccine, is safe and effective in lupus patients. Some studies, however, suggest that this vaccine may be mildly less effective in patients with lupus compared to those non-lupus patients. However, as I mentioned before, even partial response is better than no protection at all. There are two forms of the flu vaccine. The most commonly given is the shot, which is the inactivated or dead version of the vaccine. The nasal spray is the live vaccine and is less commonly given. Only rarely is there a true contraindication to the flu vaccine. For those patients who've had a prior episode of Guillain-Barré syndrome, which is a neuromuscular condition that has rarely been linked to the flu vaccine in the past. It was previously thought that patients with egg allergies could not receive the flu shot. However, this was because earlier versions of the flu vaccine were developed in a laboratory using cells from eggs. However, more recent versions have been found to be safe and contain essentially no ovalbumin and so are safe for most patients with egg allergies. One thing to remember too is that the flu shot is given every year. Each vaccine contains 3 to 4 strains of the flu which were common in the previous season. So because the flu virus changes rapidly every year, getting a new vaccine is important for everyone. Next slide. The pneumonia vaccine is also important for lupus patients. This is actually a set of vaccines recommended for lupus patients because of their immunocompromised state. There are 2 versions, the pneumonia 13 and the pneumonia 23. Together, these can help prevent most, but not all types of pneumonia. The schedule for the pneumonia vaccine is a bit complicated and depends on your age and previous vaccination status. But to simplify, in adulthood, each person receives essentially 1 dose of each of these vaccines with an update of the pneumonia 23 after 5 years and a booster of the pneumonia 23 after age 65. Next slide. The human papillomavirus, or HPV, is also an important infection and vaccine for patients with lupus. Because lupus patients confer a higher risk for cervical cancer, this is thought to be due to difficulty clearing the HPV infection. This virus can lead to several types of cancer, including several of the strains of cervical cancer, as well as oral and genital cancers. The HPV vaccine is recommended for all lupus patients under age 26 years of age. This is given as a series of 3 shots over the course of 6 months. Next slide. The shingles vaccine is also important for lupus patients. The shingles is a reactivation of a chickenpox virus, which most of the older population, like myself, experienced as a child. Nowadays, children are vaccinated against this virus at a very young age. Lupus patients are at higher risk for experiencing shingles compared to the healthy population. The shingles vaccine is approved for the general population over the age of 50. There was an older version of the shingles vaccine, the Zostavax, which only produced 50% protection, but the newer vaccine, Shingrix, which is an inactivated version, is probably safe for most patients with Shingrix, or most patients with lupus. Next slide. In the last decade, the United States has seen a record number of measles cases. These are mostly clustered in areas, small geographic areas like New York City and Minnesota. So why is this happening? This is probably due to some families in these clustered areas who've chosen not to vaccinate their children for measles. Measles eradication requires herd immunity, which means that the majority of a population must have immune memory from either vaccination or prior infection. The question of whether or not an adult lupus patient should get an MMR booster. This is a tough question because the vaccine is a live vaccine, which is generally contraindicated for immunocompromised patients like those with lupus. For most patients, if you've had a full MMR series as a child, you likely don't need a booster during adulthood. It is important to note, though, that your vaccination status is important, but also your household and your close contacts. So any young children and close contacts should be up to date on vaccinations, including measles, so as not to transmit them to immunocompromised patients like those with lupus. Next slide. Although this topic does not apply to essentially anyone now because of the coronavirus pandemic, I thought I would touch on it so we can all imagine our future travels to wonderful places. Vaccines are required for some traveling, depending on where the person is traveling to, whether it's a rural or an urban area, what infections are endemic to the area, as well as the season of the year that you're traveling. The CDC has a very good guide for this. And in addition, there are some special infectious disease travel clinics that can be helpful, not only in providing recommendations for what kind of vaccines a person should get, but also to provide those special vaccines that may not be available in a primary care doctor's office. In some situations, this is important to take note ahead of time because several of these vaccines take several doses over several months. And in addition, a person may need to reduce the amount of medications they're on to allow their immune system to have an immune response. Next slide. Did we lose you, Leslie?
Leslie lost her connection.
Yeah, I think Leslie lost her connection. We'll give her just one more minute to see if we can get her back on. So everybody, if they just want to hold tight. Seeing if I can connect with her, please, everybody. If you could just keep holding on for us for just one more minute, that would be great. I think I've been made the presenter, so I'm going to try to pull up my screen here for just a minute. We'll just have to get back into Dr. Antonelli's presentation. Oh, it looks like we might have Leslie back. Hi. We can't hear you right now, Leslie. Giving her just another minute. We do apologize for this. The wonders of technology these days that we have to rely on during COVID. But hey, we do our best to bring you the information.
You have to take the good with the bad.
Yeah, exactly, exactly. So Leslie, it looks like you have control of the screen. So if you can't talk, that's okay. We'll let Dr. Antonelli keep going as long as you can control the slides. Okay. Are we at the right location here?
I can't see us. Oh, there we go. We were on slide. Good. Next slide. All right. Excellent. Sorry about that. Okay, so although I won't go into details, some patients with lupus have a much higher immunosuppression than others. For example, patients who are on chemotherapy like cyclophosphamide or certain biologic medications, higher dose steroids, or some conventional medications will have a more of a stronger effect on the immune system. And so these patients will be at a higher risk for a more complicated infection. These patients on these kind of medications cannot have a live vaccine. Patients who are given live vaccines on these medications carry a higher risk of a more disseminated or severe version of the infections. Next slide. So one important question that I encountered while I was preparing for this talk was the idea of vaccines causing lupus flares. If we know that an infection can cause lupus flare, then what about a vaccine? Should a vaccine be able to do the same? However, the good news is that most research indicates this is not true. Most inactivated vaccines like the flu vaccine, pneumonia, and tetanus vaccinations do not cause an increased risk of lupus activity. There are some rare case reports that I found that lupus flares can be triggered by the more unusual vaccines like hepatitis B or Norwalk virus or polio vaccine. It's important to note that some of the best guidance from the experts suggests that the best time to vaccinate in a person with lupus is when the lupus disease is quiet or in remission. When a person has active lupus during a flare or when there's significant organ involvement, the immune system is busy doing other things to fight off the lupus. And so the vaccine will not cause a good immune response as when the lupus is quiet. Next slide. And now the slide everybody has been waiting for, COVID vaccine. When I was asked to do this talk in April of this year, there were only 6 vaccines in trials against COVID. So that would be the top picture here. And at the time, it was a phenomenal scientific feat. For a virus which had been non-existent 6 months prior, to have that many vaccine trials in such a short period of time is really a truly human marvel. When I was updating this slide 2 weeks ago, I found something called the coronavirus vaccine tracker. And there's actually several of these, but the one that I snipped a picture for you here is from the New York Times. And it's really an excellent site if anyone is interested in keeping up with this. It describes all the vaccines that are undergoing rigorous safety and efficacy trials for numerous companies. At this time, there are nearly 50 vaccines in trials for humans at various stages. This does not include the 88 preclinical vaccines which are being investigated in animals, which may eventually reach human clinical trials. The majority of these vaccines will first be tested in healthy humans, first testing for safety, and then testing for COVID antibody response, and finally testing for real-world efficacy. Does it work? Does it prevent the infection? What you see here on the slide is about phases which indicate those stages of development. The early stages, as you can see, there are a lot of vaccines in testing, which potentially won't make it to the later stages. The clinical testing in patients with lupus will likely be something that we won't see right away. So we'll have to kind of buckle in and hold on for the long term. Next slide. To wrap it up, some take-home points, since I talked about a lot today. Vaccines play a really important role in the health of lupus patients by preventing infections as well as preventing lupus flares. Most vaccines are safe in lupus, especially the common ones like flu and pneumonia, which are recommended for lupus patients. And the best time to vaccinate is when the lupus is quiet and in remission. Thank you.
Thanks, Dr. Antonelli. Can you guys hear me okay?
Yep.
I apologize for that moment of cutting out there. You know, it's some technical difficulties going on. But we do have some questions, and we will open up the chat box here. And so here we are. Are there vaccines that only come live? Meaning, will we ever be able to get the particular vaccine? I'm sorry, hold on.
Oh, I think I know what the question's asking. Like, for example, is there a vaccine that only comes live and not a dead or inactivated version? I think that's what the question is asking. And I am not going to lie, I am not an infectious disease specialist, but I think offhand that there are. I think the rotavirus vaccine, which is given to children, is a live vaccine, and I don't believe that there is a dead or inactivated version, but I would have to double check and look that up. And I believe that the measles, mumps, rubella is only given live. I don't think that there is a dead version of that one as well.
Well, thanks. I'm glad you clarified that, Dr. Antonelli. Thank you. Okay. Can or should lupus patients participate in COVID-19 vaccination trials?
So the clinical trials that test for, or that kind of go for the approval, safety and approval process for something like a vaccine, go through several different stages. So the first stage is generally testing in animals. The second stage is generally testing in healthy individuals. So in general, they're looking for general safety issues in a person who has absolutely no diseases. The third phase is generally look for efficacy. I'm not exactly sure if safety trials in individuals with chronic conditions like lupus are included in the phase 3 trials, or if those are generally done after approval, kind of in later phases. But in general, chronic conditions are usually contraindicated, which unfortunately kind of poses a problem. For example, one of the shingles vaccines that I talked about, lupus patients are not included in those trials, and so we generally just don't know about how well lupus patients are going to respond until many years after it's been kind of in circulation and they have sort of post hoc trials.
Gotcha. Okay. Here's a good one. My husband and I are in the process of adopting a baby. Congratulations. And we are required to get the whooping cough shot. Is it safe for lupus patients to get this vaccine?
I think whooping cough is pertussis. I think it's pertussis, and pertussis is part of a Tdap, and so Tdap is a dead virus, and so that is one that's recommended for everyone, including lupus patients. So I would say yes.
Okay. Okay. And then you talked a bit about, well, you did talk about the Pneumovac and the 2 different vaccines there. So that was great. You did address that. Here's a little bit of a long one. I have SLE and suffer from discoid lupus problems also. I'm 44 years old and I've been given 2 of the HPV shots. And yes, I have already had my flu shot. Also getting the HPV shot is good for my age and illness. Is it good for her to have the HPV shot in her 40s?
So I think the reason that the HPV vaccination is given to younger persons is because in general, before the HPV vaccine existed, HPV was so prevalent that some of the data that I read that essentially persons who are meeting, by the time a person gets to college and has their second sexual partner, 98% of young females will be infected with HPV. So the target when the vaccine came out was to eradicate this virus. You want to vaccinate people who have never been exposed. So you want to vaccinate those teenagers and adolescents before they reach sexual maturity, before they even come into contact. Now, the question of a person who is older, it may still be very helpful. I would say it's just a personal opinion that vaccinations are great for the immune system. They challenge the immune system in ways that I think we don't fully understand. And sometimes you can see kind of wonderful downstream effects that we don't know because we're challenging the immune system to new things. So, I mean, I can't give sort of personal advice, but it sounds like some smart rheumatologist recommended it, and I would say follow through on that third shot.
There you go. Okay. Okay, if we have children, do we need to separate ourselves from them for a period of time when they've received a live vaccine?
That's a good question. So some of the live vaccines in childhood do produce a period afterwards where the infant child will be shedding the live infection. So for example, I'll give the personal example. So when my infant was getting the rotavirus vaccine, my mother was on chemotherapy, and I asked this very question, and the pediatrician said, your mother does not get to change any poopy diapers for at least a month, because the data suggests that there's shedding of that rotavirus. The rotavirus vaccine is given orally, given by mouth, and so it's kind of into the gastrointestinal tract and will be in the dirty diapers. And so for up to a month, you can see that live vaccine. So I would say if that question, the certain live vaccines, if the pediatrician can't give a good answer, an infectious disease doctor might be able to help us kind of determine how long the person should be sequestered. And it should also really depend on the patient, the lupus patient's medication status. So someone who's on, let's say, Cytoxan, which is a really powerful medication, is going to be much more at risk for contracting a severe form of the infection in comparison to a lupus patient who is only on Plaquenil, for example.
Okay. This is an interesting, living with SLE lupus, is it safe to give blood?
Wow. You know, I haven't given blood in a while, but you go through a very long 50 or 60 questions, and I'm not exactly sure if they ask if you have lupus. There's a very long medication list that is exclusionary. So I would suspect it's going to be your medications that would be a contraindication, but not the lupus. But don't quote me. I'd have to look that up.
That's okay. And perhaps talk with your physician and see if that's okay for you to do. Just one more question, Dr. Antonelli, and I really appreciate this topic. A lot of questions have been coming in, so if we didn't get to them, we'll definitely circle back. It is a little bit of a longer question. I've always felt that my military vaccine caused my issues. I had a second round of many vaccines, including an experimental pneumonia vaccine, in which I had an allergic reaction, and basically my body turned on itself. Never had health issues before. I've been against them since. I cannot get past the mental block in my head to get every vaccine. Is it just in my head? I ended up on cyclosporine, and I get that reaction, I get that reaction under control. Thanks. That's a tough question. Some experimental vaccines. Do you think you could address that?
Yeah, I mean, just in a general way, I think we have to remind ourselves about the general pathophysiology of what we know about why lupus happens to certain people and not to everybody. We know that lupus probably comes, like most autoimmune diseases, with a bit of genetic predisposition, that some individuals are from birth going to be more predisposed to developing an autoimmune condition. And then there's something that is a trigger. So it's sort of the two-step. You have to have that genetic predisposition, and then you have something that triggers it. That trigger in some individuals may be something like an infection, like mono, the EBV virus, the CMV virus, and in other individuals, we don't know what the trigger is. Is it something that you ate? Is it a vaccine? Is it something that you touched? And I don't think we know that yet. So I would not say that it's in your head. It may be that it was at some point in your life, and you can't pinpoint that it was that experimental vaccine. I know that military folks go through a very rigorous, I've seen vaccination records from some military personnel, and so to pinpoint, was it the experimental vaccine versus one of the other vaccines? Like I mentioned, there are case reports that say that you can flare lupus, that lupus flares have been reported after, say, the polio vaccine, which is given widely to children, right? So what's to say that wasn't the original trigger 10 years before, right? I don't think we really fully understand also that the temporal aspect, that was it something that started now, you got the vaccine, and within a week later, it could have been something that happened years before, and the immune system just takes a long time to develop.
Yeah, lupus is so tricky, you know, what's coming first or what's the cause and reaction. So definitely. Thank you, Dr. Antonelli, for addressing those questions. And again, so many were coming through. I did my best to filter through, and perhaps at the end, if we have more time, we'll ask more questions. Okay, so this brings us to our next presenter, and Dr. Katherine Nolan Lu. I hope our audio is connected. I can see you very clearly. And let me just advance my slide here. I apologize. But here we go. Katherine Nolan Lu is a graduate of Icahn School of Medicine at Mount Sinai in New York, New York. Dr. Lu is a board-certified rheumatologist and has had over 6 years of extensive work experience in 4 states. She has numerous publications in the relation to dermatology. For 3 years, Dr. Lu was the main investigator on a study in the Department of Dermatology at the University of Miami. Currently, she's working at Metro Health Hospital in the Department of Dermatology, and she joins us today, and we are very excited to have you, Dr. Lu. And I will pass it over to you.
Thank you so much for that introduction. Can you hear me okay?
Beautiful.
All right, thank you. So thank you so much, and I'm so glad to be here. Thank you all for joining us. I'm so grateful to Lupus Foundation for all your amazing work. And it's really an honor to speak with you guys today. So I'm going to be talking about lupus in your hair. I don't have any relevant disclosures. So just to start, you know, this is such an important issue. Hair loss just has such an incredible psychological impact on all of us and, you know, all the patients who suffer from this. And it's actually pretty common among patients with lupus. Over half of our lupus patients suffer from this. Today, I'm going to be discussing the 2 main types of hair loss that we see. The main difference between these 2 types is one causes scarring, so it's more of a permanent type of hair loss, versus non-scarring hair loss, which is actually the more common type we see in lupus patients. I'm going to touch on briefly the type of workup we like to do, and then discuss treatment options, you know, new updates in the field, and also non-medication-based strategies that everyone can use to improve their hair and reduce hair loss. So first, I'm going to discuss scarring hair loss. So this is a type of hair loss that is classically associated with lupus. The other main name for it is discoid lupus or discoid lesions that we see. These classically are these red, scaly areas. They can occur on the scalp, but also in other areas of the body. And then they're very symptomatic. So often there can be itchy, they can be painful. And then over time, as the inflammation subsides, patients are left with areas of scarring and a lot of changes in the color of the spot. So often we can see lighter areas and darker areas. Here's a photo showing a patient that had experienced very severe discoid lupus on the scalp. And so as you can see, there's areas of Oh, next slide, thank you, sorry. As you can see, there's areas of inflammation on the sides of the area that's involved, and then on the right is a close-up image. So this is a tool that we utilize as dermatologists to analyze the type of hair loss that the patient is experiencing. It's called dermoscopy. So we can look very up close on the scalp and use polarized light. And as you can see, this area doesn't have any hair follicles, and you can see this combination of lighter and darker areas of color on the skin. Next slide, please. So discoid lupus. So around 20% of patients with systemic lupus experience this type of hair loss. And then in contrast, patients can only have discoid lupus and not experience systemic lupus. And so only around 5 to 10% of patients with discoid lupus go on to develop systemic lupus. And the scalp is the most common site that's affected, and around half of patients with this type of hair loss experience symptoms on the scalp. It's about equally common in men and women, which is a little bit of a contrast to systemic lupus, which is more common in women. It's also more common in Black patients. And unfortunately, the hair loss with discoid lupus, it can be irreversible and permanent once the scarring develops. So it's so crucial that we identify patients with this early on so we can manage to save the hair and prevent the scarring from developing. Next slide, please. So just briefly to discuss the treatment options available to patients with discoid lupus. So first of all, the really important thing to do initially is to see a dermatologist. We often like to take a small sample of the skin to send it to the lab and look at it and be able to make a diagnosis of this condition. And then once we've confirmed a diagnosis, we often treat this with steroid treatments. We can either use them as in the form of a cream or injections. Just some other things that are good to consider that are not medications, but very important to avoid the sun. I often have my patients, cover their heads, use, hats, things like that to protect their skin from getting flares of this. And related to that, vitamin D supplementation can also sometimes be helpful, especially if you're avoiding the sun. And then finally, smoking. So stopping smoking is something that's really important, as this can worsen the hair loss with this and also make it more resistant to treatment. So one of the main treatments we use is plaquenil or hydroxychloroquine, and smoking can make this less effective for this type of hair loss. Next slide, please. So just kind of briefly what I mentioned before, here are some photos showing treatment. So this is on the left, or sorry, on the top images, you can see a gentleman with discoid lesions. And then the bottom slide shows after he was treated with a combination of hydroxychloroquine as well as a topical steroid cream, clobetasol. And we also use injections every 4 weeks. And this is a photo 4 months after treatment. And so even though the discoid lesions can be permanent, if we're able to catch them early enough, patients can regrow their hair in the areas involved. Next slide, please. So next I'm going to talk about non-scarring hair loss. And so this is actually the majority of the type of hair loss that I treat in my clinic. And it's also the majority of the patients with lupus experience some variant of these types of hair loss. And there is overlap between the different conditions, and we'll discuss how to distinguish various features between the different types. Next slide, please. All right, thanks. So here is a photo of a patient with lupus-specific alopecia. So sometimes patients come into clinic and they talk about, that they've been diagnosed with alopecia, So it's interesting, alopecia just means hair loss. So it's just a very general term that can be used to describe all the many different types of hair loss that we see. This specific condition, acute lupus-specific alopecia, is a type of hair loss that's seen in patients who have acute lupus and are having often an acute flare. Sometimes it can actually occur before the flare occurs, and it almost is like this harbinger of what's about to come. It can be either diffuse, which means it's affecting the entire scalp, or it can be patchy. You can see discrete patches sometimes. And that can often make it be confused with another type of hair loss that we see called alopecia areata, which is another autoimmune condition. And there's some clinical overlap with these two conditions. And one thing that is good about this specific type of hair loss is that once the lupus has improved and the flare is improving, often the hair loss will improve as well. Next slide, please. So this next condition is a little bit controversial. So it's called lupus hair. And it's there's some controversy whether or not this is a discrete entity of itself or if there's overlap with some other more common types of hair loss. And so basically it's characterized by these very dry, fragile, short hairs that patients experience often on the front of their scalp. Patients often complain that their hair just won't grow. Their hair is, brittle. It's not the same texture as it had been in the past. It can be relatively common in patients with lupus, up to around 30%. And it's thought to be due to either breakage of the hairs or just very slow hair growth. And it's often associated with increases in disease severity and when the lupus is flaring. And some patients also have changes in the color of the hair. So they can actually get these like fine little white hairs growing in when the hair is recovering. And as I mentioned, there's some overlap with other types of conditions. And so some people consider this a variant of just hair shedding that occurs with a kind of a stressful event on the body. So whenever we have severe illness, we can get shedding. And so some people think this is a variant of that. Next slide, please. So this is a photo showing a patient with this kind of characteristic lupus hair. So it's kind of characterized by these short hairs and just they're often very fragile and do not grow as long as the hair had previously. Next slide, please. So just some management tips, and these really can apply to lupus hair, but also, any other of the types of hair loss that we discussed. So some things that can be helpful is just trying to limit any further damage to the hair. So definitely limiting using, heating tools, straighteners, curlers, any sort of chemical treatments on the hair. So, chemical relaxers, and also styling products that can irritate the scalp, especially in conditions like discoid lupus, the scalp can be very, very sensitive. So avoiding alcohol-based products. And also tight hairstyles, so, tight braids, things like that can really damage the hair further and cause further hair loss. Next slide, please. So next I'm going to discuss some of the non-lupus specific types of hair loss. So, of course, our patients with lupus, they also can develop types of hair loss that we see in non-lupus patients as well, just based on, the fact that they're taking, certain medications and also with illness and, hospitalizations, things like that. Sometimes when people are sick, they can be at risk for other types of hair loss. Next slide, please. All right. So telogen effluvium. So this is kind of a big word, but it's probably the most common type of hair loss that I see. And essentially what it means is just shedding of hair. So I'm seeing a huge epidemic of this currently this year, just a lot of stress on a lot of people. Also, COVID illness itself, people have very severe telogen effluvium afterwards. I'm seeing it about 3 months after people have been sick with COVID. But this can occur with really any sort of systemic stress on the body. I had the pleasure of experiencing this personally after having a baby last year. It can be very scary when it's happening. You just see all this hair on the ground. You see, you brush your hair, you see in the photo, just a ton of hair coming out. Any sort of like fever, when steroids are withdrawn quickly. So patients with lupus, sometimes if they're tapering off certain treatments, and also some of the other, medications that are used sometimes for lupus can sometimes trigger this. And basically it's just characterized by severe shedding of hair. I diagnosed it in the clinic with something called a hair pull test. So it sounds kind of barbaric, but what we do is we just gently tug on the hair, and then we can analyze the hairs that come out to identify if the patient has this condition. And it's very important in these patients that we send a lab workup as well. So I often like to check things like iron, vitamin D, thyroid levels. And sometimes if we correct this, if there is a imbalance, patients will then recover and the hair will start growing back. So often with this type of hair loss, usually it occurs about 3 months after some sort of illness, a lupus flare, some sort of medication change. And then the fortunate thing is that the hair does regrow. So it usually will regrow several months after that once the body has recovered. Next slide, please. So here's a photo just showing a patient with pretty severe telogen effluvium. So as you can see, you can lose, 50% of your hair density. It can be pretty impressive. Next slide, please. I'll show some photos of kind of the before and afters of when patients recover. So just a little bit more for things you can do if you're experiencing this type of hair loss. It's very important to have a balanced diet. I've sometimes seen this in patients who are on very restrictive diets. Sometimes people who are on just plant-based diets, if they're not getting enough protein, it's very important to make sure you're getting kind of a balanced diet in your daily routine. Also, as I mentioned, correcting abnormalities with iron, vitamin D, also vitamin B12, folic acid, things like that can also impact the hair and cause shedding if they're abnormal. These next things are a little bit controversial. There's kind of mixed literature on it. I sometimes will use melatonin supplements. It can sometimes help to kind of reset the hair cycle. So sometimes I'll use those briefly for a few months in patients to help kind of restart the hair growth. Also, we're using PRP injection. So this is platelet-rich plasma. It's a procedure we take someone's blood and then we use the plasma to inject in the scalp. And there is some data to support that this helps the hair to regrow more quickly. And then finally, sometimes I will use things like topical steroids and minoxidil, which is topical Rogaine. That's more of a treatment for just kind of, common thinning of the hair, but I found that can also help to thicken the hair and while it's continuing the process of growing back. Next slide, please. All right, and so here are just some photos showing patients with this type of hair shedding, hair loss. And as you can see, the patients will have usually these kind of regrowing hairs that start to grow in a few months after we're able to correct whatever the issue was that triggered the shedding. So it's important. It can be very scary when it's happening, but these patients usually, in my experience, do very well. especially once we identify something that we can correct to help them regrow the hair. And so you can see kind of from left to right, these patients, I think most of the photos were taken around 6 months to a year afterwards, and the hair usually will grow back in the areas that had experienced the shedding. Often the shedding is most prominent kind of on the temple areas of the scalp, especially in women. And you can also notice it along your part line. As the hair starts to grow back, it will fill in these areas. Next slide, please. Oh, I think there. Perfect, thanks. So just the workup. So this is so important. You know, it's very important to see a hair expert or a dermatologist if you're having any sort of hair loss, because, you know, I'm sure a lot of this may be a little bit confusing because a lot of these types of hair loss can have a lot of overlap. And so it's so important to have an evaluation with using this, you see kind of in the image on the top left, that's a dermatoscope, and we can look up close at the hair follicles, and there's various clues that can tell us what's going on with the hair. As I mentioned, things like a hair pull test we can use as well to see what types of hairs are falling out, how much hair is falling out. And then we also utilize labs, so just checking things like thyroid, vitamin levels, and sometimes I will check things like, you know, an ANA in patients who don't already have an existing diagnosis of lupus. And then finally, the last step that we use is if we can't figure out what's going on with these other tools, we can do a small skin biopsy. And this is a very, may sound like a scary procedure, but it just takes like 2 minutes to do. We just take a very small, like, you know, 3 millimeter spot on the scalp. And then we send it off to a lab. So you can see in the bottom right, this is just showing some of the pathology that we see on the slides in a patient with lupus involving the hair follicles. And so it can really be diagnostic to distinguish between different types of hair loss that can look very similar clinically. Next slide, please. So just some general tips, and this can apply to not just hair loss, but, you know, dealing with lupus affecting other areas of the body as well. So I really strongly recommend protecting the scalp and protecting the skin, you know, on the face and the rest of the body with sun protection. It's very important to help prevent flares of disease. One tip I found helpful is, you know, when you're covering the head, if you look at a hat and you can see light kind of coming through the fabric or coming through the hat, that means it's not going to provide enough protection. You want to make sure it's pretty opaque. You can also look for UPF ratings on clothing and on hats. That gives an idea of how protective it is against UV. I also like to recommend, especially patients who are losing some of the hair on the scalp, then the skin on the scalp is more vulnerable to the sun. So you can actually use, we have these kind of powder sunscreens now that can be used on the scalp. And I've had a lot of patients, you know, have a really good improvement with this in terms of reducing flares by actually just kind of dusting their, you know, scalp and hairline. And there's also some other, you know, products that are safe to use on the scalp. And another thing to be aware of, I have a lot of patients that come in and then tell me they're taking biotin supplements. There's, you know, mixed literature on this in terms of hair loss. I personally don't think the literature is that great on use of biotin for regrowing hair, so I usually don't recommend it. But one thing to be aware of is taking biotin can actually really impact your other labs that are drawn. So it can cause kind of errors with the way things like even thyroid and heart, you know, type labs show up. And so it's always good to tell your doctor if you are taking biotin before they draw any sort of labs for you. And then just some other things to consider. So you can get UV blocking shades for your windows, you know, things like your car. Usually the dashboard, you know, the front window is protected, but sometimes the side windows are not. Even things like certain fluorescent lights sometimes can emit a little bit of UVB. So it's very important to make sure you're protected from UV light throughout the day. Next slide, please. All right, so in conclusion, it's just so important that patients who are experiencing any sort of hair loss are able to get seen quickly and get a diagnosis early on, just so we can best manage the hair loss, especially because sometimes in patients with lupus, the hair loss can be scarring. And so we want to act very quickly to calm down the inflammation and to stop the hair loss before it becomes potentially permanent. And it's just so important to have a good collaboration with our rheumatology doctors and then our other doctors that are managing the lupus. And us dermatologists, will be involved in that collaboration. And I know at Metro Health, so for the patients who are in the Cleveland area, we are offering a lot of expanded telehealth and video options right now. And so I'm very involved in doing evaluations of patients through video visits, especially for our vulnerable patients right now. With COVID, they don't have to come in. We can usually get them in even within a few days. I know sometimes we have a problem with patients being able to get good access to dermatologists. So I just wanted to have everyone know that that is an option, and so they can be evaluated and get a comprehensive analysis of their hair condition. And they don't even have to necessarily have an office visit to do that initial step. Next slide, please.
So,
all right, so thank you so much. I'm so glad to be here. I'm happy to answer any questions.
Thank you, Dr. Lu, and I apologize for running through the screens a little quickly there at some times or too long. But yes, thank you for your presentation, and I'm going to open up the chat box again for anyone that may have some questions here for Dr. Lu. And just give me one moment as I pull them up. And so here is a question. Are there any specific products recommended for hair loss? I'm specifically looking for a shampoo that may help. And I know you addressed a couple of them, but could you reiterate? Is there any shampoos that could help?
Yeah, that's a great question. That's a question I get every day. A lot of patients, are looking for like topical, products that can help with their hair loss. What I find is it's best to use products that are not irritating to the scalp. I think if you're using a shampoo that you're happy with, I wouldn't, try to, there's a huge industry of this with all these, kind of expensive products with hype about regrowing the hair. And unfortunately, since what's causing the hair loss is a little bit kind of deeper, in the skin and the hair follicles, I don't, really think any current shampoos will really regrow the hair. But I do recommend products that are gentle, that don't have a lot of, chemicals in them, not a lot of fragrance. There is a brand called Free and Clear, which has very minimal, chemicals and ingredients that can cause allergies. So I think that is a good one to consider for patients, especially that have sensitive skin from these types of hair loss.
Yeah, okay, great. So lots of questions coming in here. There's something here about, what about light helmets? And I think they're talking about like light stimulation for hair regrowth. And you addressed a lot about sunlight. Can you speak on that?
That's a really good question as well. So light, I know they have these these red lights and LED light type devices. Usually that's used more for people with called androgenetic alopecia, or just kind of common hormonal type hair loss that we see often. So men, male pattern balding, and women can get a similar variant of that. I honestly haven't been that impressed with the literature on a lot of those products. They're often, pretty pricey, and I haven't really seen a lot of convincing evidence they work so great for that type of hair loss. I also would be cautious in patients with lupus, just because there is that sensitivity to UV light. And I would just definitely discuss with your rheumatologist or your other doctors before trying any sort of light device, because of a potential risk that there would be some sort of UV possibly emitted as well. Sometimes small amounts of UVB can be emitted as well with light devices. So we wouldn't want to, do the opposite and cause, a flare of the lupus.
Oh, yeah. Okay. So, okay, my doctor says my hair loss is permanent. I'm considering getting a weave to help with volume. Is this something that I should do, or will it cause more damage and hair loss?
Yeah, I mean, that's a good question. So as I mentioned, some of the, kind of things that pull on the hair, so things like weaves or, tight hairstyles, sometimes can damage the surrounding hair. I totally understand that is a difficult issue though, and if you want to try to cover up areas that are damaged from the lupus and aren't going to be regrowing back. So I definitely do have patients that do use that. I do tend to favor more of like wigs because then it doesn't put that same stress on the surrounding hair. But possibly something to discuss with your dermatologist if there is a way to maybe to do the weave where it doesn't cause pull on the surrounding hair. I know there are some techniques now that can be used that are a little bit less damaging.
I know hair loss with a lot of patients is a very sensitive topic, and we want to maintain, our beauty and whatnot. So that's always, something to be mindful of there. Okay, so what suggestions do you have for SLE patients with cystic acne that are in their 40s? Can you address that, please?
With cystic acne, yeah, I mean, so I'm seeing this a lot increasing, especially in women. Often men, the acne will improve in their 20s, early 30s, but us women are lucky and sometimes have this going on into later in our lives. So I don't necessarily treat patients with lupus differently than I would other acne patients. I think it's really good to see a dermatologist. There are some kind of hormonal-based treatments that we can use now that kind of block some of the male hormones that can flare the acne, medications like spironolactone. And usually these are very safe in patients with lupus. So I think just good to talk to your dermatologist and discuss the other medications you may be on and just come up with a good plan.
Okay. We're also getting lots of compliments to thanking you, Dr. Lu, and just people giving just warm greetings and appreciating your chat here. I should mention that. But just one more question here. And then again, if we have time at the end, we'll address additional questions. So the last question here is also about 9 months ago, my straight hair started turning very curly. I never had curly hair. Can this be from any medications? I take hydroxychloroquine, 200 milligrams, twice a day, and I have hypothyroidism and take Synthroid, 75 micrograms. Could you talk about the texture of the hair, if it changes over time? Have you seen that?
Yeah. So it's interesting. I have actually seen that in certain patients. Sometimes, when patients get something, like I had mentioned about the telogen effluvium, the shedding, or sometimes early types of thinning of the hair, people can notice changes in texture. Sometimes people talk about kind of these like kind of kinked hairs or, just a change, like sometimes even dramatic things, like I've seen patients go from straight hair to curly hair. I think it has to do with the hair cycle. So sometimes if there's some sort of kind of reset that happens with the hair cycle, patients can develop kind of a difference in texture of the hair. I don't think it's anything to be concerned about. Sometimes the hair eventually will go back to the original texture from before, but definitely changes in hormones. So I think she mentioned the thyroid changes. I've seen it sometimes after pregnancy. I've had patients, non-lupus patients, experience that. So, the hair, I think, is such an interesting thing because it's kind of this window into the body, and that, just, minor changes in our hormones or, illnesses, things like that, the hair can kind of signal that something else is going on. And so I wouldn't be concerned about that, but it's definitely not an uncommon thing to happen.
changing that texture. And then just kind of follow up to that, you did talk quite a bit about lupus hair. Do you think that's due more to the illness or treatments for patients?
Yeah, so I think it's probably a combination. I think it's a combination of patients having kind of this chronic inflammation affecting the body. And then certainly, treatments can sometimes cause, shedding as well. It's a tough balance because, of course, the most important thing is treating the lupus. And so I think that is probably the best way to try to get the hair, improved. But obviously, things like, like Cytoxan, some of these more stronger medications, even, taking systemic steroids, those types of things can definitely impact the hair. So I think most likely it's an overlap of both of those.
Yes, it's very complicated too as well. So thank you, Dr. Lu, so much for your presentation. We're getting lots of responses again. So I thank everyone that's submitting questions. If we have time at the end, we'll try to address more. And also this program is being recorded and we will be able to post this out later. So some people are asking if they can have a copy of this presentation. We will get that out there for you guys. So thank you again, Dr. Lu. It was very, very good presentation. And so this brings us to our next speaker, who is definitely no stranger to all the virtual summits that the Lupus Foundation of America Greater Ohio chapter have been doing. Does it look like her hair's blown because she's been from Philadelphia to Mechanicsburg to Cleveland, Ohio, and meeting with all of you today. So thank you, Cindy, for joining us. I know you've had a very busy morning. And I haven't heard your audio yet. So could I get a quick hello, just mic check?
Hey there, can you hear me?
Yes, I can. Great. I just wanted to be sure.
Yep.
So let me just do a quick bio for you, even though everyone should know who you are since you've been hanging out with us so often. But Cindy Fisk is the patient engagement liaison for GSK. She's from Mechanicsburg, Pennsylvania, and she has 25 years of experience in the healthcare field and pharmaceutical industries. In her current role, she travels extensively educating lupus patients, families, and healthcare practitioners about lupus. So with that said, thank you, Cindy. And I don't know if you want me to make you presenter or if we should just keep rolling through. You tell me.
Yeah, no, just keep rolling through. When I go to take everyone out to the website, though, I'll probably ask you to just transition over. So thank you, Leslie, and the entire LFA Greater Ohio, and to all of you for joining today. And yeah, there was a time I was traveling extensively. Now it seems to be in this virtual world like everyone else. But I always start my presentation just with kind of giving the background to why I do what I do and the passion behind it. As Leslie mentioned, my background's in nursing, so I always like to take people, and not to date myself, but a few years ago to when I was in nursing school. I remember spending a lot of time learning about the immune system. And I will tell you, when we got to lupus, it really wasn't much more than a few paragraphs and we moved on. Fast forward to today, and when I run into young nurses out in the field, I've learned that not a lot has changed. They still spend quite a bit of time learning about the immune system and just a little bit of time learning about lupus. So that's why I'm so passionate about the work that I do with GSK. It's in a completely unbranded role. I don't speak about any products. It's all around empowering those living with lupus to be advocates for themselves in the management of their disease and raising awareness for lupus. So we'll go through some information today. The goal of today is really to, when I talk about empowerment, it's empowerment with tools and resources. And I'm going to spend some time talking about the Us on Lupus program and some resources that go along with it. And Leslie was kind enough to put them in the actual webinar. So you'll see as I talk about them, you're welcome to download them, but they're out there for you. So keep in mind that anything we discuss today is really for educational purposes only, not meant to take any place of that important conversation you should be having with your doctors and your healthcare team. So with that being said, Leslie, if you could advance the slide. Okay, so why is it important to monitor your symptoms? It really is so important to put a system in place, and that's what's going to bring us to this resource piece. The LFA has some great resources. Us and Lupus has some. So as we go through this, think about what you're currently doing or not doing to monitor your symptoms, and think about either putting a plan in place or enhancing what you're currently doing. So it's so important to monitor what's going on with your lupus so that you can tell that whole story when you're in front of your doctor or your healthcare team. Because if you're having signs and symptoms, right, of lupus, this is known as active disease. And this active disease is associated with an increased risk and damage to your major organs. So it really is, every symptom matters. Whether you believe it's related to your lupus or not, share it with your doctors, with your healthcare team. Let them decide, because it could be a sign of some sort of lupus-related inflammation that could lead to organ damage. And you're not alone in this monitoring, right? So it's a team effort. So you know your body best, right? You know what's going on. You're doing your own self-assessment. You've got a rheumatologist on board doing their assessment of what's going on. There's probably some lab work that's being done and testing. And then you're most likely, I guarantee that everyone on the call today is seeing more than one doctor. So if you think about the way that lupus impacts the body, if you are, having issues with, like Dr. Nolan had shared, with hair loss or skin issues, you're most likely seeing a dermatologist on top of a rheumatologist. If your heart's involved, you may be seeing a cardiologist. Kidneys involved, you might be seeing a nephrologist. So it really needs to be a team effort to really put this whole story together. Next slide. Okay, so that's why it's so important that you put in place a system so that you can track what's going on with your lupus and tell the whole story accurately, right? Journals are a great way of monitoring and keeping track of what's going on with your symptoms with your lupus, and also a good place to jot down questions. Involve friends and family. Use mobile devices. We live in this world of technology now. Use your mobile device, even if it's not an app. The notes section. I document everything in notes. Have your medical records available when you're in front of your doctor or your healthcare team, whether that's face-to-face or through telemedicine. Have it available and, ready to talk about. And just as important as tracking symptoms, it's equally as important to track, are they changing over time? How are they impacting your daily life, right? Are they stopping you from doing things you enjoy? Think about a time that maybe you weren't able to go out to dinner or out with a friend, or perhaps it was a child's sporting event. Is your lupus getting in the way of things that you enjoy? And then also keep track of how it makes you feel, right? Are you feeling depressed or isolated or frustrated? These are all equally as important to track as symptoms. Next slide. So resources. And you can go to the next slide, Leslie, that's okay. So you need to know you're not alone in all this, right? You've got family and friends, you've got your doctors, your healthcare team, you've got organizations like the LFA Greater Ohio, which is the whole reason you're all here today. And you also have usandlupus.com. So usandlupus.com, and you can go to the next slide, Leslie, is a website that's maintained by GSK. Some of you on the line may be familiar with it. It's completely unbranded. There's also a Facebook page that some of you may be, part of that whole community, but it really was designed to go beyond just facts about lupus. It was meant to empower those who are living with lupus, to give them the confidence, and really it's all about empowerment to face their lupus and have more meaningful conversations when they're in front of their doctors. And that if you haven't been out in a while, I'll take you out there shortly. It has a whole new look and feel to it. The site, it really is beautiful, and there's a lot more information out there. Next slide. So we'll quickly go through some of the tools and resources that are out on the site. There's no cost to enroll in Us and Lupus. It's gone completely digital as they've revamped the site. So those of you who may be familiar with it, if you have previously enrolled, you received items in the mail. Well, we've gone completely digital, so everything will be sent via email moving forward. But there's resources and tools, a checklist, a tracker, and Leslie again has all of these in the chat area, an appointment prep guide, and a lupus dictionary. So as we go through this, think about what you're currently doing to manage and track your symptoms, or what you're not doing, and think about what you could be doing to put a plan in place. Next slide. Okay, so the lupus checklist. The lupus, it's one of my favorite. Maybe you're not a journaler, right? Maybe you're somebody who just wants a checklist. The checklist is a great way to go down a list, identify, recognize what may be going on with your lupus, you know, a symptom, a flare, maybe it was chest pain, or you had a rash or joint issues. Just a way to really just to keep track in a list format of what's been going on with your lupus, how long it's been going on, is it new since the last time you saw your doctor, and simply just check off. On the back of the list is an area where you can document some notes, maybe some questions, and again, have this tool in front of you when you're meeting with your physician so you can have that meaningful dialogue. I also like the checklist if you're somebody newly diagnosed and you don't know what to be on the lookout for. This is a great way to really identify and recognize what may be associated with your lupus and check it off. Next slide. The tracker. So the lupus impact tracker, you know, we said it was just as important to monitor and keep track of symptoms, but equally as important to track the impact, right? What's the impact that your lupus is having on your life? The tracker allows you to give a score to the impact that your lupus is having. The lower the score, obviously the less impact. The higher the score, the more impact that your lupus is having on your life in that given period of time. And again, have this information along with, you know, how you're monitoring your symptoms when you're meeting with your healthcare team. Next slide. Journaling. So journaling is a great way to capture thoughts, feelings, track your symptoms, write down questions. Again, this is something that they'll send you, you know, when you enroll in unsafe.com. You know, but it's also something you can go to your local dollar store, right, and buy a journal. Find a way to keep track of your symptoms, monitor what's going on with your lupus. If journaling's for you, I can tell you to journal. I encourage you, as you see some of these tools, think about what's right for you, right? If you're not a journaler and I encourage you to journal, you're not going to stick with the plan. So come up with a system that really works for you personally. Next slide. The appointment prep guide. So it's so important to really prep before a visit. Have you taken note of your symptoms? And this appointment prep guide is a great way to just, it's a list of things to remind you of what to do. Have you taken note of the impact that your lupus is having on your life? Have you gathered your medical records? Have you gathered the medications that you're on? Because chances are your doctors are going to be asking you about that. And then have you chosen an appointment buddy? If you have somebody that is able to either sit with you during a telehealth appointment or be there with you during a face-to-face, it's a great way to have an extra set of eyes and ears, somebody to take notes, so that you get the most out of that visit. Next slide. And the dictionary. If you think back, for those of you who've had your lupus diagnosis for a long time, when you were first diagnosed, you were thrown into a whole new world of medical terminology, right? The lupus dictionary is a great way to gain understanding and of what conversations you're having with your doctor when they start to use certain terms that are lupus related. Help you have that meaningful dialogue. I'm also a big fan of sharing this with friends and family so that they too have an understanding of what you're speaking about when you talk about your lupus. And Leslie, I don't know if it was with you guys or maybe it was Philly, one of the LFA chapters, where somebody had come off chat and said, I'm getting one of these, or, you know, going to make sure that I send a copy to every single one of my family members for the holidays. It's just a great way to have that meaningful dialogue so people understand what you're talking about and so that you understand what your healthcare team is talking about. Next slide. Okay, so this is, I'm going to take you all out to the new site. But before we do that, if you hover your smart device over that QR code, take the camera out, you will be able to kind of follow along. You can go out onto the new website itself. So
It'll take you right there. Yeah, took me right there.
Oh, awesome. Okay, I like when a plan comes together. So if you have been out to usandlupus.com, you're looking at a completely new site. So this was revamped back in October, has a whole new look and feel to it. There's so many new sections that I'm so thrilled are on here. There's a section on symptoms. There's a section on living with lupus. I'll briefly kind of drill down through some of these sections talking about lupus. Finances and lupus is a completely new section that didn't exist previously on the site. Some basics, and then one of my favorite areas is the far right. We have a section dedicated for caregivers. This is a section that also did not exist in the previous format. And then if you look up here at the top right, if you need resources in Spanish, so if you decide to enroll and you need the resources in Spanish, click on that option up on top and you will be sent the information in Spanish. So again, that's a new feature that wasn't there previously. So for the sake of time, because I know we're running close, I'll just briefly, so when you come into Us and Lupus, this will be the home page that you will land on. And there is information on this page, and you can quickly, if you want, you can put your email address in. And again, everything has gone digital. That will start the enrollment process for you. And they will send you a kit with all the tools in it. And again, that will come via email. So there are sections here that you can click on. You want more understanding of your symptoms, how to have a more meaningful conversation with your doctor and your family, how you can take better care of yourself. And again, getting that symptoms tracking kit are all located on the homepage. But you can also drill down on the other section. So you can click on symptoms in depth. And by doing that, and I don't want to make anyone dizzy by scrolling through too quickly, but this will give you areas where you can then drill further onto specific symptoms. So maybe it's you're concerned about hair loss, as you know, Dr. Nolan's presentation. You can click here and it'll give you some more information on specifically addressing hair loss. And then at any given time, you can drill down even further and you can go right back up to the top by the right-hand side there. There's topics, living with lupus. So this was all really meant to just give you ideas on symptom tracking, nutrition, sleep, stress relief, exercise, sun safety, a lot of the topics that were discussed today. And by clicking on any of these boxes here, you can get additional information. There's a section on talking about lupus. And again, same format with additional specific topics. Maybe you need more information on talking with your doctor, or perhaps you need some more information on talking with loved ones, how to manage your healthcare team, right? So that everybody is aware and connected and talking to each other in the management of your lupus. Or children and lupus, and this is specifically geared on how to really talk to your children about your lupus. And I'll drill down on that. And what's really nice about this section, it gives specific guidance by age group. Now, if you have a child that's 2 or under, 3 to 6, or 7 and up, really specific guidance around how to engage in that conversation and really what to share based on the age. And then I'll scroll back up to the top. There's a section on finances in lupus. And again, within this section, additional areas that you can click on. So the cost of living with lupus, right? Some basics on how it can all add up, how to navigate insurance, where to go for financial help. So this is a really important area that, again, did not exist on the previous website. There's basics of lupus. So this is more around just facts about lupus itself, including what is lupus, just general facts, lupus nephritis, again, because the kidneys are often impacted by lupus. Some resource organizations that you can turn to, LFA being one of them that's mentioned. Types of lupus. Dr. Nolan also talked about discoid lupus. So here it talks about the 4 types of lupus that are out there in addition to SLE. And then what is a flare? So this is information on the basics of lupus. And then I mentioned for caregivers, and I'm excited about this section because so many of the events that I attended last year when we were face-to-face, what warms my heart the most is when I see people come in with their loved ones to these seminars. So we've dedicated an entire section specifically geared for the caregiver around their own self-care and addressing stress in the caregiver, communicating about lupus. So this is, again, geared for the caregiver, how they can share what they're feeling with you, the lupus warrior, and how you can strengthen just your bond through this communication. And then parenting a child with lupus, and I'll click on that as well. So for the parent, say if anyone that is on the line that might have a child that has been diagnosed with lupus, just some tips on how to open up and have that conversation with your child about their own lupus. And with that, I will turn it back to Leslie to see if there's any questions, but I encourage you, if you have not gone out to Us and Lupus, check it out. Consider how you're currently monitoring your own lupus, how you're keeping track of symptoms, how you're keeping track of the impact that your lupus is having on your life. Empower yourself, be an advocate for yourself, and tell the whole story when you're sitting in front of your doctor. So.
Thank you, Cindy. Yes. I think we keep developing these new tools, and we're definitely sharing them. I know a lot of our support group facilitators are using them in group. You've done some training with our patient navigators throughout the state, and so we are getting lots of positive feedback. I know people are using the tools. In this webinar right now, if you look to the right-hand side, there are attached handouts to this program that Cindy's been talking about. So right from there, that handout section, you could download them right now. Of course, you can always contact us or go ahead and fill out the website to receive those documents that you've just shared with us. So thank you so much. Just a couple questions here now. Someone's saying, yes, a lupus dictionary is great. I have a lot of family that don't understand what lupus is. Oh, it looks like Christmas presents. So I guess she's going to be passing that out to everybody. Sorry. Okay, let's see here. This one's pertaining to the symptom tracker that you guys have. It says, how can I tell if I'm in a flare when I use the symptom tracker? I feel like I'm never really sure when to contact my doctor. Do you recommend asking my doctor if I mark all 3s or 5s? And I think they're looking at
the impact tracker.
Yeah. Mm-hmm.
Yeah. I think that goes back to, the communication piece. I encourage you to talk to your doctor. If you're noticing something and you're keeping track, this is information to share with your doctors. We live in a world technology, right? We've got portals, you can call, but really that conversation, let your physician make that decision. You know your body best, so communicate what's going on, but they'll be the best to determine whether it is related to your lupus or not.
Okay. Lots of questions coming through, and I am particularly looking for questions for Cindy. So here's one. I find often I forget my symptoms. I tend to remember later when they flare up again. What do you recommend? What do you recommend?
Well, what I recommend is what you think works best for you. I think it goes back to what I said earlier in my presentation. If you're somebody who loves to journal, I encourage you. And I think people sometimes think journaling, you have to write this story. You don't have. You could make a list within a journal. You have to find a system that works for you, but it is crucial that you put something in place to monitor and track what's going on, because I know myself, I've had doctor appointments where in my head, I'm like, okay, I want to ask this, and this, or share, X, Y, and Z. I leave the appointment, I'm sitting in the parking lot, or I've gotten home, or I've hung up from a telemedicine appointment, and I'm like, oh yeah, I forgot to mention this. So it's so important that you put some system in place. Maybe the checklist, maybe you're a checklist person, or the notes section of your phone. We have so many different ways that we can monitor, but I really encourage you to find a system that works for you, so that you don't do yourself a service if you're not telling the whole story when you're in front of your physician. I had a young gal in Indiana tell me once that she keeps Post-it notes all over the house, and whenever something's going on, she jots it down. I'm like, well, that's great. As long as day of your doctor appointment, you're running around, right, and grabbing all those Post-it notes, because they don't do anyone any good unless you're sharing that information.
Yeah. This kind of goes along with what you just said, and I know this particular person, so I know this isn't true for our rheumatologists and doctors here, but this person's saying, my rheumatologist spends very little time with me. I feel like I leave without the doctor answering my questions. What advice do you have to conquer this conversation? Any advice about getting that 15-minute time slot that we have with our physicians' busy schedules? Do you have any advice for this patient?
Yeah, I mean, write your questions down in advance. I mentioned that the checklist has a space on the back. Journaling, you can write your questions down. If you have an appointment buddy, somebody that can also, I would suggest that you don't leave without your questions getting answered. I don't know if the doctors on the call have any suggestions regarding that. I mean,
Dr. Ballou, do you think any suggestions for a patient that feels they don't have enough time, or that they forget to ask the question to their rheumatologist when they're with them?
Yeah, I think that writing down your questions to get answered by the doctor is extremely important. Interestingly, there's been some recent study that suggests at a single patient visit, patients only remember about 40% of what they talked with their doctor. So so the doctor is going to be speaking fast, probably using some big words, and only 40% of it is remembered. So you might as well write down your questions so you can get the right questions answered. We all forget, and that's okay, but we want to get the important stuff answered.
Yeah. Yeah,
Yep, so
absolutely.
be sure to write all of those questions down, and maybe not spread sticky notes throughout the house, and put them all in one place, and download the tools from us and Lupus. Definitely check out the website Cindy was talking about, because these are valuable resources that are free and available to you that will only help you prepare for your doctor's appointments, be better engaged with your physician, because it is a two-way street, right? As patients, they have lots of things going on, and physicians are treating a large population of patients who can be difficult, and that's why these tools are available.
Yeah, and physicians aren't mind readers, right? So you have to be prepared to tell your story when you're in front of them.
Yes, definitely. Cindy, I thank you so much for your presentation and for always being with us. As patients here in this group may know, Cindy is always available with us to chat with us. So if anyone had other pressing questions, she is always available, and we're happy to connect together. I think there's some support group facilitators that would love for you to come join their group that I talked to yesterday. So we'll have to see what we can do.
Sounds good. Thanks for the opportunity.
Thank you, Cindy. I do want to be respectful of everybody's time, and I thank everyone for attending this summit. The virtual summit is a great new tool for us, but please be sure to fill out the evaluation after this program. One will be emailed to you an hour after, and if you're on your computer, a pop-up will come up for you to answer the survey. I do want to thank our sponsors, GSK, us and Lupus, the Ohio Commission on Minority Health, for helping us provide symposiums like this. This is all new virtual world for us, and I apologize for my technical difficulties. I do try my best to coordinate and get everyone together, but there's always a few little glitches that I'm always trying to work past. For any questions that may have been coming up, and we're getting lots of responses of thank you, docs, thank you so much for this information, lots of positive feedback here. If a question was submitted that I was not able to get to, you can email that to me and perhaps I can get it over to the physicians to perhaps answer at a later time. I do apologize, there were many questions that came through and I will be reviewing them and hopefully get those over to the doctors. But if there was something pressing we did not address, please feel free to email us, info@lupusgreaterohio.org, or my email, leslie@lupusgreaterohio.org, and I will do my best to get your question answered.
Thanks, it's been great fun.
Thank you, Dr. Ballou. It really has been great fun. Thank you, Dr. Antonelli. Thank you, Dr. Lu. Cindy Fisk, always wonderful to have you. Well, I hope everyone has a great rest of the day, and I hope you enjoyed this program. Thank you all.
Hi, everyone. Great to see you.